Today on Inside the Outcomes, we're talking about assistive technology with a focus on wheelchairs, wheelchair breakdowns and repairs, and how these breakdowns impact the people who use wheelchairs. Our guests today are Dr. Lynn Worobey, Assistant Professor of Physical Medicine and Rehabilitation at the University of Pittsburgh and Principal Investigator on a collaborative multi-center project led by the University of Pittsburgh Model Center on Spinal Cord Injury. The project is called Equity and Assistive Technology for Individuals with Spinal Cord Injury, or EQuATe, and the Shirley Ryan Ability Lab Midwest Regional Spinal Cord Injury Care System is a collaborating center. Lee Tempest is a research coordinator on the EQuaTe project and is also a wheelchair user. Welcome to the podcast, Dr. Worobey and Lee. Lee, you're a wheelchair user. Can you talk a little bit about your injury, your experience with breakdowns, and what happens when your chair is out of commission in terms of your daily life?
I'm a wheelchair user of 34 years. I was injured in a motor vehicle accident when I was 18 years old. So I've been doing this quite some time. And so, of course, I've had plenty of wheelchair breakdowns over the years. A lot of times this affects me. It's not only is it dangerous for me, it has falls. I've had casters that I've had to just take out because they're rusted and I'm waiting on new ones. Where I would fall, there's a chance of falling. It's really hard on my shoulders and wrists and stuff. I get a lot of soreness from that when parts are wore out. I've taken it, as a wheelchair user for many years, a lot of times I take the responsibility on myself because I can't go waiting very long for parts. So I will buy my own at times, tires, tubes, casters, or go to a hardware store if I need a bolt and use a bolt from there for the time being, which is not ideal to do, but you got to do what you got to do while you're waiting. That makes it very hard to, it only messes up the chair more because there are bolts that don't go to that. So there's more wear and tear on the chair as that.
There are quite a few consequences to having a chair that is not in proper order.
Yeah,
Have you ever missed work or doctor's appointments or
I have had to sit home from work at times and work from home because the chair is not able to go into get into my car, travel into work like that, push down the sidewalk. I've needed some time to do some repairs for it. So
Lynn, what does equity mean in terms of assistive technology and what do we mean when we talk about disparities in assistive technology?
So I think equity in assistive technology really means that everyone, so regardless of income or insurance or background, has consistent access to the equipment and support that they need to move around, to participate, and live independently. But it's really not what we see in reality. We've done several national studies and we found that people with public insurance, lower income, or from racial or ethnic minority groups are more likely to experience wheelchair breakdowns, face more severe consequences. Some of the things that Lee talked about, but it could be stranded, missing a medical appointment, being stuck in bed. And we see this for other types of assistive technology too. So things like a quality wheelchair or access to smart home tech. But interestingly, when we look at sort of veterans in the VA system, we see a lot of these disparities disappear. So this might suggest that things like the comprehensive coverage and coordinated repair systems that are within the VA healthcare system might actually help to mitigate some of these disparities. But I think that that's what equity should look like. So not just providing somebody with a chair, but supporting it reliably across its lifespan.
So when we talk about the EQuATe project, and that stands for Equity and Assistive Technology for Individuals with Spinal Cord Injury, can you talk a little bit about the project, what the question is, what you're hoping to find out from the project?
Sure. So it's a collaborative module that's funded by the National Institute on Disability Independent Living and Rehabilitation Research through the SCI Model Systems program. And the big goal is to understand sort of the use and impact of assistive technology among people with spinal cord injury and sort of what equity looks like in the population. So we've collaborated with other centers. This cycle, it's 12 different centers that include Shirley Ryan Ability Lab. And we, for the last about 15 years now, have been looking at wheelchair repairs, tracking how often chairs break down, what causes it, and how those breakdowns affect people's lives. When we first started collecting this data, we asked sort of just a simple question. In the last 6 months, did your experience a wheelchair breakdown? And then did you have a consequence from that? And we found that 45% of users reported at least one breakdown in a 6 month period, which, if you think of kind of a car as analogous, if you in every 6 months were experiencing at least one breakdown, people would be pretty upset. And in our most recent data set, that number is up to about 80%. So it's not a problem that's going away. It's actually getting worse. And we know that these failures aren't just kind of technical problems, they're things that have very human consequences to them. So a broken joystick or a dead battery means somebody can't get to work or school or sometimes even the bathroom safely. Our most recent data shows that about 40% of users experience serious consequences from these breakdowns. So it's really not just a problem with the technology, but kind of a public health and equity issue too.
And then what do you think is driving the increase in the number of people who say they've had a breakdown in the last 6 months? That's quite an increase.
I think it's probably multifactorial. I think there are challenges with wheelchair quality. I think there are challenges with preventative maintenance not being supported. So generally, insurance won't cover repair until something's already broken. So rather than maybe doing some things that could prevent all of these downstream consequences, you've got to wait till you have a problem. And that's an issue. Lee, anything you want to add on that one?
No, I agree with you that it's the preventive maintenance. You're not, no one's checking in with you. You go till it's broke, and then you're going to wait some time period. You can't do it before anything before to help you out. Like, especially us here, like the winter, I can't have extra casters knowing that sometime in the winter here, I'm going to get a lot of water and stuff into bearings, and it's going to break eventually here. But if I want backups, I have to buy them myself. There's no like preventive piece to this. Like, I could get something once a year and they can just give it to me. I have to have something wrong. And that makes it tough because it'll be rusted out, and now I'm waiting for them to give me some parts.
Another thing that I comes to mind is we don't often teach users how to maintain their chairs or what they should be looking for. I think with a car, a lot of people know every 5,000 miles I should change the oil, but many people don't maybe necessarily know how often should I need a new cushion, how often should I be cleaning my casters, things like that.
Can you talk a little bit about what it looks like when you need a repair? I know in a previous call we talked about vendors, so the brand that has made the wheelchair, and you need to reach out to them. Is that how it is for everybody, or like what is it? What would it look like typically if something's wrong with the wheelchair? What's your first phone call?
My first call is usually to the company. It's a middle piece. I have, if you have like a tie light or a quickie, you don't necessarily touch base with them. You touch base with the vendor that you got it from. Like, we have local vendors here, like a company called like Blackburns, and we can contact them and tell them what we need. They will contact the insurance company and try to get it approved. They will order the parts for you, and then they will bring them out to you. And when you when they can schedule in your area, or meet up with you, as they are very busy. The companies that do this they're always on the run, so that you're going to wait for that time period. And
Does somebody come to your home to look at your wheelchair?
they can sometimes. Nowadays you can take pictures of it and show that to them to show that it's broken down. They will try to come and assess it first to make sure, because they got to order the right part, so they got to make sure that they do a checklist of this part, that part. They will do that after you had called them. They will show up, they will evaluate your wheelchair, they will order the parts and contact the insurance company.
And there's a lot of pieces in that that can kind of slow things down. So oftentimes you need a pre-authorization for the repair, which is kind of ironic that you've jumped through all of these hoops to prove that your wheelchair is medically necessary. And now you have to again prove that it's medically necessary to have a wheelchair that works. But then ordering parts takes time. If the vendor doesn't kind of have them in stock, you have to assume that it's the right part that comes in. Vendors aren't reimbursed for that time that they spend making visits to people's homes. So sometimes you're waiting till there are other people in your area where it's worth the vendor coming out. So I think all of these things add days, and the more days you add, the more consequences people are experiencing in their daily life.
What is the average cost to somebody for a repair?
So I think it ranges. In terms of how long repairs take, our data shows there's sort of a median of 2 weeks, but many people are waiting a month or longer. We've had people report up to 6 months that they were waiting to have a repair done. And vendor involvement can kind of be a bottleneck. So our data shows about 1 in 5 repairs are either never completed or done incorrectly. For vendor reported repairs, I think the median that we had from our data is about $150, but it can exceed $600 depending on the part and insurance coverage. And for a lot of users, there's often not a backup chair. The wheelchair that they're in is their means of mobility. So when it's out of service, they're effectively grounded, or they have to use an old chair that either is in a state of disrepair or that no longer fits them or meets their needs.
I probably experienced personally when I order parts, it's at least 2 months. I imagine at least 2 months before I get them. Um, and then they'll want to come out and schedule. That's 2 months that they get them in, and then they'll try to schedule a time to actually bring them to me when they're in my area. So I will wait for that as well. Depending on the part, I might tell them like, you know, deliver to my house, to drop it off. I'll fix it. Or have them meet me at work if possible, because it's like the cable company or something like that. Like they'll say like we'll be there between 8 and 3. So if I have to work that day, I take the day off if I have to go into somewhere and wait for them. That makes it tough as well.
So we talked a little bit about maintenance before. Lee, do you practice maintenance yourself with your chair?
I do. It's because of a lot of experience. I do preventive maintenance now. When I first got hurt, that was something I didn't learn a lot about. I had to learn that as I went along, what actually breaks down. They taught me parts of the wheelchair in rehab, but I didn't know how frequently things do that. So casters and stuff like that. I know tires are going to lose air if you have a manual chair. I understand that piece, but I had to learn that along the way and learn how long it's going to take me to get a part and what I have to go through to get a part. So I've learned over time to the chair that I have is try to keep it in the best shape that I can. And then when 5 years from now, when I'm able to order another chair, at least that chair is somewhat in good shape and I do have a backup. And like Lynn said, it's not ideal because I'm getting older. You lose weight or you gain weight or those type of things happen. Your posture changes. So, that chair is not going to be able to suit you for a long period of time, but it's nice to have that, but it takes time to get that. A new user of 3 to, from 1 to 5 doesn't have that advantage. They don't have a backup chair at all. You've got to wait that long to get your second chair. So you don't have that. And that's somebody new who hasn't learned how to push the chair yet, hasn't learned, maneuver the chair better, is still getting stronger technically in a manual chair, or still learning the pieces, parts of how they break down, like I had said. So there's a lot of factors that go into that, and that can really affect your life early on. You know, an older individual, a younger individual might be able to get away with some of that, but somebody a little bit older, that's going to be tough on their body. That's going to be dangerous for them and be tough on their body.
Dr. Warobi, can you talk a little bit more about what you found related to wheelchair service provision, specifically about prescribing chairs and providing training and maintenance and wheelchair skills?
Sure. So the World Health Organization has 8 essential steps that they've outlined of the things that we should be doing when we provide somebody a chair. They sort of take you from the referral process to assessment, fitting, training, follow-up, maintenance. But our research shows that in the US at least, we're really missing a lot of those steps or they're really fragmented. More specifically, in our recent studies, we found that a third of people didn't get their wheelchair from a clinician, so there was no clinician involved in that process. About two-thirds faced at least one major barrier in getting their chair, so things like insurance denial or being forced to self-pay for components. And then, even more concerning, 80% of people reported they didn't get any training related to maintenance and less than 20% of people got both skills and maintenance training. So this means people are leaving kind of the rehab pipeline without knowing how to safely navigate their community or recognize when something's wrong with their chair. And these gaps are, I think, no doubt probably contributing to breakdowns and safety risks and lower satisfaction with life.
To add in on that, I agree. I'm working on a spinal cord unit. The length of stay is so short. I was lucky back in the early 90s to be able to stay a little bit longer. So I got to learn a little bit more of skills and a little bit more of maintenance. But nowadays, we're just trying to get them stable, trying to get them set up well, just to start. But they really didn't learn any skills at all in rehab here, and barely touched on maintenance of their chair. You talk a little bit about what can go wrong with them, but you can't really show them and go through it. You just don't have the time anymore. You're just trying to work on to get them physically stable to leave.
And I think the same thing happens in outpatient. So it used to be you could kind of kick the can down to outpatient, but those visit counts are shorter too. So our data looks at kind of from inpatient to outpatient what people got, and these gaps are there. So inpatient, outpatient, they're just not getting these trainings.
So even once you're discharged from inpatient rehabilitation and you're on an outpatient basis, there's no standard spot where a wheelchair maintenance or wheelchair kind of parts is included in the outpatient rehab.
Yeah, our data says that only about 20% of people report that they got maintenance training anywhere along that continuum.
They do some outpatient rehab somewhere that's maybe a little bit rural. They might not know enough about that information. And then you didn't get really any in inpatient, and then you go somewhere rural and have somebody there with you. They're gonna, of course, give you physical therapy, but do they know skills and maintenance of a chair? Because not always are they taking care of a lot of those individuals, at one time in a rural area. So
So this is a question for both of you. What would you like to see happen going forward, either in an inpatient or outpatient rehab setting, in terms of ways to kind of prevent breakdowns from occurring and any changes in policy or provision of services that would speed up the repair process?
Want to go firstly, or you want me to?
go ahead, Lynn. You're more than welcome.
So I think some things is a shift maybe from this reactive stance to one that's more proactive. So treating maintenance more like preventative healthcare. I think stronger durability standards can be helpful in making parts more accessible so that users are able to complete some of these repairs on their own when they're able. I think clinicians and suppliers integrating maintenance education into the standard of care would also help things. I think accountability from insurance and vendors for timely and quality repairs. I think there may also be some opportunities to bring in smart tech to this space, so connected sensors to detect issues or ways to kind of streamline the service continuum, are all things that maybe could be helpful.
I agree. Just streamlining it a little bit and, maybe some regular follow-up, yearly follow-up, how most people do with their PCP, but you follow up with, somebody who could understands the equipment that your assistive technology that you are using, um, understands breakdown and can help you do preventative maintenance, and insurance is being on par with that, working with you to know that this person is using this type of equipment. Let's keep this up to date before we cause more injury to this individual or more frustration with them. If we could stay on top of that, it might even help out the vendors in ordering parts when they know this is coming up constantly, and make it a little bit smoother for them, waiting for them, even for the insurance to approve it takes some time too. And they're doing other things, and things get lost in the shuffle because there's so much happening at once of many individuals using this vendor piece, and things come up with somebody all the time. So I think a better streamlined system would much improve a lot of this breakdown.
Yeah, I think there's a bureaucracy component to that, right? Like the pre-authorization. I think there was an NCART study that showed 97% of the pre-authorizations are approved, and they tend to add about 2 weeks on average. So there's like a very simple example of something where if it's just an extra step, maybe how can we reduce that and cinch up that time?
What is next for the EQuaTe study?
So I think that continuing to track this data is important. I think that there have been some states where there's been legislature introduced to support it. I think having data to understand the impact of those would be great. And I think continuing to sort of pull out data that we can use to advocate and influence policy is important. I think more detail that people can go to Congress people with to have stories and data behind these are the things that matter.
So, how has some of your research findings from the EQuaTe project influenced policy?
I think that we're really happy that one of the outcomes of this work has been building out a sort of a data foundation that people have used for policy reform and advocacy across a number of states. It's informed different right to repair legislation, efforts to remove some of these pipelines, sort of policies that require vendors to meet timelines and service what they sell. There are a few states that have passed legislature, a number of states that are considering legislature. Pennsylvania is one of them. Senator Tartaglione in our state has a Senate bill that's in committee currently about preventative maintenance, faster part ordering. Consumer contact lines are also things that are important. There is also some work on the federal stance by United Spinal Association has been a big advocate there to sort of really move these things into law to be able to make a difference.
This podcast is supported by the National Institute on Disability, Independent Living, and Rehabilitation Research. This is your host, Sharon Parmet, signing off.